Hi everyone. In today's clip, I want to talk a bit about Alzheimer's. Please note that anything I record here are for informational use only and it's not intended to diagnose or cure any ailments. Alzheimer's is a common type of dementia or intellectual decline. At one time, this used to be considered to be quite rare, but unfortunately quite common nowadays. And it does not only impact elderly, but even like younger generation. So this ailment was first identified back in 1906 by a German neurologist named Alois Alzheimer. One of the characteristics of this ailment is that it is a progressive mental deterioration to a degree that impacts the person's day-to-day routine and functioning. Deterioration in critical areas of the brain sort of may come first, as much as like 20 or 40 years ahead of time. As it progresses, there will be severe memory loss, particularly short term. And at this stage, disorientation also will set in. So the person will experience inability to find the right words, have major mood swings, or become completely unpredictable, as well as severe confusion, disorientation, or even hallucinations or delusions. Some become violent and angry, while others may become docile and passive. At the later stages, they might wander about sort of without any purpose, experience incontinence, and they might neglect even their personal hygiene. So on the physical aspect of this ailment, the nerve fibers surrounding the hippocampus, which is the brain's memory center, become tangled, and the information is no longer carried properly to or from the brain. Now, new memories are not formed, and the old ones cannot be retrieved. And there are also plaque accumulation in the brain. Now, many of us forget sort of where we put our keys or glasses or a word here and there, but that is not an indication of Alzheimer's. A good example between forgetfulness and Alzheimer's is if you don't remember where you put your glasses, that's forgetfulness. But if you don't remember that you wear glasses, that's dementia, right? So other disorders can also cause similar symptoms. For example, arteriosclerosis, which is hardening of arteries, which slowly cuts off the blood flow to the brain, killing brain tissues from series of minor strokes or pressure from fluid accumulation in the brain. They all can look similar, as well as small sort of blood clots in vessels that supply the brain with oxygen or blood. Also, brain tumor, hypothyroidism, advanced syphilis can have the same symptoms. Drug reactions and interaction and poor diet can also physically and mentally have the same type of present the same type of issues. So Alzheimer's patients tends to have low levels of B vitamins as zinc, vitamin A, vitamin E, boron, potassium, selenium, as well as high concentration of aluminum in the brain. One way to get rid of aluminum in the body is silicic acid or silica consuming silica. It binds to aluminum and it reduces its bioactivity. So the Journal of Orthomolecular Medicine, volume 39, number 3, in 2024, mentions that a diet that has been specifically developed for protection of the brain is called MIND, Mediterranean dash diet intervention of neurodegenerative delays. And this has been strongly sort of associated with slower cognitive decline and risk of Alzheimer's disease. The unique feature of the MIND diet are based on evidence for foods and nutrients associated with dementia prevention, including eating green leafy vegetables and berries, and not much so of fruits, dairy or potato consumption, and not more than one or so fish meals a week, But clinical trial of the mind diet is still underway, of course. So there's a lot to be said actually about this ailment and the findings. And just to touch upon some of the successful experiment sort of topics and not to get too deeply into the subject, they have worked on improving mitochondrial function, nutritional approaches, vitamin B therapy, omega-3 fatty acid status optimization, increasing brain phospholipid supply, and a whole lot more. So essential nutrients to prevent or slow down the progress are things like acetylcholine, L-carnitine, coenzyme A, coenzyme Q10, folic acid, multivitamin, pycnogenol, selenium, B complex, and zinc, as well as herbs like butcher's broom or curry, St. John's wort, ginkgo biloba, but make sure that ginkgo biloba is not taken if there are any bleeding disorders or there's a scheduled surgery and so on. So experts recommend to keep the brain active and busy to slow down the progression. Stay away from processed foods and eat natural balanced diet along with a supplementation program. Have a hair analysis to rule out the heavy metal intoxication. Stay away from allergens. Avoid alcohol and smoking, and make sure to drink purified water. If you're speaking to someone who deals with this issue, avoid saying things like, "Do you remember when?" Or "I just told you that," or "Your brother died 10 years ago," or "What did you do this morning?" or "Do you recognize me?" Or even make really long sentences or trying to speak to them like a child. Spiritually speaking, this ailment is a representation of the person wanting to leave the planet, an inability to face life as is any longer, not being able to cope or understand that everything happens at the right time, space, and sequence. When facing adverse events in life, suppressing emotions, depression, and extreme grief appears to be associated with an increased risk of developing dementia or Alzheimer's disease by actually 5 times. I hope this has been somewhat helpful. Like and follow for more. Be the light.